Everybody, this is Dr. Harper and Dr. Draper, and this is Cocktails and Conversations, March 22nd, 2022. Almost 3 months in the books this year already.
Yeah.
Pretty wild, right?
Yeah.
So we're going to do things tonight. A lot of times we've done this where it's been a focus on surgery, and we're going to change that up a little bit tonight. So we're actually going to be kind of a small portion of tonight's show, and then we're going to bring on our other departments, right? Skincare, we've got two wonderful estheticians that will be here, Melissa Myers and Angie Thomas, and then we've got two esteemed, wonderful nurse injectors who will also be coming out, Linda Owens and Kristen Hall. So we are kind of here for like 20 minutes, but that doesn't mean that we can't answer as many questions as possible. So if you have any questions, just kind of start feeding them into our system. It'll start kind of scrolling through our phones, and hopefully we'll be able to answer them for you. We're also going to do things a little bit different. We picked two different patients. We picked a facelift that you did, and then a mommy makeover that I did. And we're going to bring those up on the screen, all for these before and afters, and then we hopefully will be able to talk eloquently about them. Again, it's cocktails and conversations. So he poured me some bourbon, which is certainly my Achilles heel. So thank you for that. Cooper's Craft Bourbon, and I appreciate that. So let's start off with the facelift. I've talked enough. So how about you talk a little bit about what our prospective patients or our patients who may be doing this tonight are actually looking at right now when they see your performance.
Now that picture is of a lady who's fairly typical that has nasolabial fold, which is the structure, the jowl, and then the neck bands. And the flaky skin, the bands are from muscle remaining, not the extra fat. And those are all components of natural aging, skin, muscle, and fat. So they'll come in knowing they don't like what they see, knowing they look old, but not really realizing why it is that they look old. So we analyze the face for those different things. We also look at the quality of the skin and the volume, because as we age, the volume of a useful face is different than the volume of a more aged face.
Right. So if somebody comes in though and they say, I don't do anything for skincare, and I want a facelift, like, what's your kind of philosophy in getting them on a skincare regimen? What do you say to them as far as timing? Like, how long should they presumably go visit one of our estheticians and get on this kind of preemptive skincare routine so that they are optimized?
Say it, that gets their skin cleaned out and in healing mode, and it helps the surgery improve the quality as well as the quantity going on, and it just enhances the overall result. And then we really ought to maintain that afterwards. Right? Skincare is like working out every day. You know, if you work out every day, you got a better result than if you do one marathon a year, which would be coming in and having one payload, one chemical. It's nice to do both, but if you've got limited resources, I take the day.
Yeah. Sorry, I didn't mean to get you sidetracked from the facelift that patients are looking at. I've got it on my phone if you need to eyeball it. But
so the post-op result, you know, we do surgery in 2.5 hours. Do it here in the office, accredited facility, general anesthesia. Wake up with a head dressing on. You go home and just basically sleep and get something to eat. You see the next day. Change the head dressing to a lighter weight one. Make sure everything's heating properly. And then that head dressing is removed the following day at home on your own, and get the shower and wash your hair. So 2 days after surgery, there are no dressings, there are no stitches to be removed, they're all dissolvable. There are sometimes you can make incisions in the scalp and use staples and make them out at a week. These staples go in easier to come out easier if you use those intra-hair incisions. But facelifts should look normal and natural. I see those stars in Hollywood, they look weird to me too. And if my wife was having a facelift, I'd be worried about that. But as long as she doesn't do it in Hollywood,
right,
we're fine.
Right, which never makes a lot of sense to me because those people have more money than Creases, and they go get these, seemingly overdone facelifts. It just ruins it for the rest of us.
Well, it makes it more difficult.
Makes it very hard.
I think they're getting extra fillers maybe, and that changes the shape of their face, which is why they look different. Some of those people, and there are lots of them, Annette Benning, there's just so many.
Right.
And it's not that they don't look good. They look more youthful and attractive. They just don't look like themselves.
Right.
Which is the problem. I think
Right,
people don't
definitely.
look different. They want to look better.
Correct. They want to look well rested, and I think that sometimes people wait, right? And it's okay if you need to, if you wait, and not everybody that we see are 50 years old and ready for a little procedure to kind of help them along. But when things have dwindled down and it's been a long time since you've maintained yourself, and all of a sudden you come in for this huge life-changing surgery, the before and afters look startling to some people. It doesn't just look improved, it doesn't look like the same person.
And you raised a good question about when do you know it's time to do it. And a lot of that's personal preference. If you don't like looking at the mirror and you're concerned about it every day, it's time to do it. If you look in the mirror once a year and you go, I don't think I'm looking as good, I wouldn't worry about it. You gotta be bothered by it every day, every week.
Sure.
You know, every month, I'm not sure, every quarter or year, forget it, you're not ready.
Right. Now, you know, I haven't evolved into this technique yet, but I always love going back to the operating room and watching you. But give our patients, I still sneak a drain in there for a day or two, but you're doing a really neat thing. You're completely drainless with your facelifts now. How are you able to do that? I mean, I kind of know the science behind it, but let our patients know that, you know, that's something that you offer now for them to be able to go home without a drain, which sometimes is scary for patients, more scary than the surgery itself.
Yeah, you know, so 2 years ago, COVID's coming on, I was concerned about facelift patients getting COVID post-op and coughing.
Sure.
And coughing is one of those things, if you do excessively, can make your face bleed. And if you bleed, it's a nuisance bleeding. It's extra bruising, it's extra swelling, and it just looks worse longer. So to prevent that, we started doing some fibrin glue, which is part of the hemodynamic cascade of wound healing and getting things to stop bleeding. So we spray this material in, and it acts as a glue. So we'll spray it in and then reposition the skin with our hands and fingers where we want it.
Wow.
And then after a minute, it stays there, and then we tailor the skin. Because the tissues are sort of glued together and held in place with the sutures, there's no space for a drain, and there's no fluid for a drain to take. So we actually get less swelling, less bruising than we ever got even using drains. And if they cough post-op, I think we had one hematoma in 2 years.
Sure.
With it from a man, and of course men don't follow instructions. So, you know, that doesn't even count.
No, that doesn't count. No, that doesn't count. Well, that's neat. Well, next time you do several a week, so next time I need to sneak back there and see exactly how you're doing it. We'll spend a little bit of time, unless you have any kind of wrap-ups from a facelift standpoint. Of course, the caveat goes, you and I both do these surgeries. There's no doubt you do more facelifts than I do, and probably at this point in my career, I'm doing more breast and body than you are.
Easily.
But we both do those surgeries, and so you know, we also don't mind sometimes getting two doctors' opinions. I typically always go into your office and ask you your opinion before I give mine, though, so they're kind of getting your opinion twice. But you know, you specifically do a lot of facelifts, and I have to just kind of commend you on that. I don't know anybody that does a better one that I've seen, so it's been really neat to learn from you. I'm going to talk a little bit about the Mommy Makeover that's on there, and Mommy Makeovers are one of those kind of nebulous, you know, what does it entail? And a Mommy Makeover traditionally to me is just a combination of breast and body. As far as the breast goes, it can be a reduction, it can be a lift, it can be an augmentation, it can be an augmentation with a lift, it can be fat grafting, it can be any number of things to the breast that help the patient achieve their goals for the way they want the breast to look. And then a tummy, and a tummy can be a combination of things, right? It can be liposuction, it can be bringing their muscles back together if they've had children, or if they have, you know, diastasis, muscle separation that needs to be done to flatten their abdomen again, and then redraping their skin. Or it can be just removal of skin and fat, which is called a dermalipectomy. Or it can be any kind of combination of those things. For the particular patient that we're showing tonight, I feel like it's been on our Instagram and Facebook before, This is a mother of 3 that came in and just said, I'm not happy with my breasts. They have gotten smaller since I had kids and I breastfed, which is a common complaint. Thankfully for her, everything was in a really great position. She had certainly lost volume in her breasts, but she wasn't sagging unnaturally, just really didn't have volume. And then from a stomach standpoint, yes, her muscles needed to be brought back together. When I'm evaluating anyone's stomach, I'm sure it's the same as you. It's very difficult for people to just like let it all go, right? Just like show you what it looks like if they're not sucking in. If they're not looking good, that's right. So if you can stand in the mirror and just take a deep breath out and take a look at your abdomen, if your abdominal muscles look like a ball, if they're rounded out, then you know that your muscles are no longer tight in the midline and going in this kind of unilaminar direction. So that's what I tell patients for the best result. It is a slightly different recovery. You need to bring your muscles back together. And for this patient, she needed her muscles back together because she'd had several children. And so if we were going to redrape her skin and soft tissue components, we wanted to do that over a flat surface instead of a rounded surface. And so you can see the results. This was a breast augmentation with some lower back liposuction, which is 95% of the time something that we do along with the full tummy tuck. Now, so this is lower back. So when I tell patients or hips, and so sometimes the communication gets muddled. And so it's nice to tell patients, if I told you to put your hands on your hips, that's what I'm going to liposuction, so that their sides and their lower back that will go into their jeans or their bikini or any of that, the whole kind of torso where you'd wear your belt line is all kind of flowing and harmonious together. And so that's where I liposuction. I'm not one of these aggressive liposuction people that go after the mid back or the upper back or the flanks or even the central abdomen at the time of a tummy tuck. I think you're just asking for problems and issues. And when you do have an issue with a tummy tuck and problems healing, it's catastrophic, especially for the patients, because it's just psychologically worse than even the physical manifestation of having problems with tummy tucks. And so I really feel for patients whenever they have any type of complications, but for the tummy, it's especially scary because it's a big kind of part of you. And you see it everywhere.
Whatever you're doing is working because you have very few complications.
I do.
Convenience is one thing, but safety is way more important than convenience.
Absolutely. And just as kind of the old adage goes, the patients that can get a complication are typically the ones that you never saw it coming. It's like it's absolutely not the ones that you think.
All of the breast and all the tummy in one setting.
Absolutely. I think it's safe to do. We have started putting anti-embolism stockings on all our patients several years ago. We do leg squeezers, and then a combination case like that, depending upon the patient's history, the patient's age, any comorbidities, their BMI, those types of things. We'll also put a number of our patients on blood thinners starting the day after surgery to try and prevent things like blood clots, DVTs, pulmonary embolisms, which also can happen. And again, they typically happen in the patient where you just don't see it coming.
Now, when you see somebody who's, the perfect case is a mom who's had 1, 2, 3 kids, the tummy is kind of relaxed, the breasts have deflated.
Right.
That's an ideal case for all kinds of things. But what do you do when you see the patient that comes in that may have lost, 50 pounds, but needs to lose 50 more really? And, what do you tell them to get them to be a better candidate so their results are better?
I mean, that's a great question, and it's really easily managed. And so what I tell patients, and sometimes I get it wrong, and Lindsay has to correct me, I tell them, don't put the cart before the horse, right? Like put things in proper order. And what I say is, today, there's no doubt you would have an improvement. You may get a great result right now. 20 pounds from now, you may get an incredible result. And 30 pounds from now may be just earth-shattering. So, it's a strong commitment. Financially, it's a commitment for the patient. It's a time commitment. It's a recovery commitment. it's a psychological commitment for them. So if they're not putting everything in order the way they need to, then they're not going to get the best result possible. And that's not fun for anybody. So thankfully, prayerfully thankful, you and I are really, really busy. And so we don't mean to, say that so that people are scared that they're not going to be able to come in and get their surgery. But I mean, we're busy, and you want a plastic surgeon that's busy. You don't want somebody that you could just come in and, yeah, hey, Friday, let's do your surgery. It means they're not very sought after. And so I tell patients, thankfully, we're several months kind of out from the larger surgical cases anyways. And so it gives you the opportunity to get something on the books, get a date set, and then it's time. I mean, it's time to rock and roll. Like, you've got to put your effort in to lose the weight, to work on your skincare, if it's facelifts and things like that, but to try and set yourself up for not just a great result. I mean, we don't strive for great. That's a good number. But I mean, in plastic surgery, we strive for as perfect as we can get it, humanly possible. Not that perfection is achievable, but I mean, if we were just looking to put the ball in play and hit singles, I don't think we'd be as busy as we were. So luckily, we have this kind of situation now with our practice where we've got some time. And so if the patients really want us to be their surgeon, they're going to have 2 or 3 months to be able to get ready, and there's no excuse at that point. If they want to optimize their results, they got to put the effort into it, and 99% of them do, which is pretty phenomenal.
The other thing that I think you're very good at is when it's not in a patient's best interest to go today.
Right.
You're looking out for them and telling them, do the work because your results are going to be better.
Right.
And that's, putting the patient first, which is a great attitude, I think.
Absolutely. Okay, so I have neglected some questions, so I'm going to start firing them off to you. B, okay. So recovery time on a facelift.
You can look decent at a week, and we're taking pictures at 6 weeks. So, out of work, depending on what you do, if you're digging ditches, it's a little longer than if you're sitting in front of a computer and talking on the phone. In that latter case, you'd be back doing that at a week.
Okay. Are there nuances to facelifts? Is there a difference between a complete facelift or a mini facelift?
It's terminology. A complete facelift for us is face and neck. A mini facelift for us is just the face.
Right. And so talk real briefly, like a minute, on eyes. They want to know about procedures for bags under the eyes specifically, is what this patient says.
Skin, muscle, and fat is true for face and eyes. So you're looking at eyes. The reason they have that round circles is there's too much fat. There's not enough support because the muscle's sagging and the skin's sagging. So you take the fat out, snug up the muscle and the skin, and pretty straightforward thing. Eyes are the thing that take the longest to look good because they're fragile. They end up looking great and they heal great. But facelifts, because they're not fragile, they look good right away. Eyes take a little longer.
Yeah, and they can get swollen, and that can look a little strange. They can look operated on, and nobody wants to look operated on. So for a few weeks, certainly sometimes up to 6 weeks, I tell patients just, don't overthink it, don't overcritique it, give it some time. Things will look more natural once we get out of that realm. A patient asked about lower back liposuction, and would you have a bulge of skin or fat? So liposuction removes fat. It doesn't do anything to the skin. In fact, it challenges the skin by removing volume behind it, and then you want your skin to retract. So if you don't do the liposuction to the areas, if you've got fat when you put your hands on your hips, then you'll have that muffin top, and that's typically not a very sexy expression.
Yeah, and sometimes like when you make the tummy look so much better, if you don't do the hips at the same time, it reveals the hips as being too big.
Yep. How complicated is lower back liposuction? Is anesthesia required?
Yes, anesthesia is required if you're doing it to me. It's I would not want to be awake and have that done.
Okay, lower neck lifts, facelift procedures. You asked me the question. What do you tell patients about goal weight with facial procedures?
I would be the best weight you can be, and if you say I'm not at my best weight and I'm going to lose 5 pounds, that's no problem. If you're going to lose 20, I'd wait till you lose it 20 because your result will be better.
Yeah. Can a breast lift be done after an implant is replaced? Of course, we do it all the time. The combination of breast lift an implant replacement or brand new implant is done multiple times a week here. So that's a safe procedure to do. I think we have a beautiful technique for that, and we do it all the time. So yes, combine those procedures. Say you've got 25 pounds left to lose. Would that still be ideal as skin and fat would be removed with surgery? Is a good question. So you would be absolutely shocked at what 25 pounds of fat looks like. It's an enormous amount of fat. So if you are 25 pounds from your goal weight, I would say with even if we did a circumferential tummy tuck on somebody and a big breast reduction on somebody, if you combined all the weight, you'd probably be looking at 10 pounds, 12 pounds max. And that's a huge case.
You'd have to be 6'2".
Right. So if that is your particular case and you are 25 pounds, and if you got down to 15 pounds, 10 pounds, then it may get you to your goal weight. You also have to be realistic with yourself and what a goal weight is and what an achievable
and also
goal
surgery
weight
is not a weight reduction process. It's a cosmetic look procedure. So the results are better when the weight's less, period.
Several comments about my haircut. I did get a haircut. Aria Vargi is 100% the best men's and women's stylist in town, and you should try to book with him. I had been on his books.
Even for me?
Oh, yeah. Oh, he can make you look like George Clooney. So he's fantastic. Shout out to Aria Vargi. It is not in a ponytail. And my wife and my daughter are extraordinarily happy, as I think some of the staff.
Most all
of the staff, people in the world are happy that I cut my hair. Yes. Upper eye lift versus brow lift. That's a great question.
If the brows are low, brow lift. If the brows are fine, then eye lift.
How do you know if somebody's brow is low?
I mean, does it look low? And technically, the brow ought to be above the orbital rim, and it ought to be arched about 2/3 of the way out. And so if it's there and there's extra eyelid skin, then it's eyelid skin that ought to be removed. If the brow is low, put the brow where it ought to be. And if that fixes the problem, then it's just brow. If it doesn't fix the problem, it's brow and eyelid.
Right. And so you do, and I do as well, but you do an endoscopic brow lift, which allows you smaller access points.
3 centimeter incisions.
3 centimeter incisions at the hairline. So there's a scar right in front of the hairline that usually heals absolutely.
There's something magical about putting a scar on bone that makes it look fantastic.
Yeah, and it may be because, you know, those deeper bites, you are kind of sewing that to periosteum so that it stays there. There's not as much give, there's not as much movement. And so, you know, typically for those patients, it's also analogous to just putting a lot of Botox in their forehead, so their forehead's not going to move for a little while. So it's not this kind of moving target that we've got. I think potentially we have answered all our questions, which is great. We've talked about our 2 different.
Talk about the new implant placement.
I think I will save that for another day because they're kind of giving us the wrap up.
Oh, they're giving us one of those.
Yeah, nobody wants to hear about us anymore, but we are briefly placing the brand new Gummy Bear implants above the muscle. It's an easier recovery. They look gorgeous. We did 4 today, and they just look absolutely beautiful and natural.
Easier recovery.
Easier recovery. It used to look so unnatural to me for some patients to go underneath the muscle, and so the new implants hold their form, they hold their shape, they hold their place. Very little rippling, if any, in the proper candidate, but just beautiful new devices. But Dr. Graper and I are going to say goodbye. This is strange for us because normally we're here for an hour.
And cheers.
Cheers. Cheers to you. Thank you for the bourbon. And then we're going to bring out 2 of our best estheticians. They'll probably kick me for saying this. They have a lot of years behind them of doing of skincare. So they are 2 of the most knowledgeable people you could possibly ask questions to. All 4 of our estheticians are phenomenal, and they're really terrific. So they're going to come talk to you about some of the specials, talk to you a little bit about ZO, who is sponsoring this, which is fantastic.
Go ZO.
So welcome Melissa Myers and Angie Thomas. Thanks, guys. Cheers.
Cheers.
I'm Melissa Myers, one of the 4 estheticians from Graper Harper Cosmetic Surgery, and I'm here to tell you about our skin pen microneedling. You've probably heard a little bit about it here and there, beauty blogs and such. Well, we offer this treatment, and it's in a series of 3 done every 4 to 5 weeks apart. If you're looking in the mirror and you're not happy with the little fine lines and the pores that you're noticing that are becoming a little more noticeable, this can be helpful. So what we do is actually have you come in and we'll numb the skin topically, because there's some little needles that are going to go into your face. It's very tolerable with the numbing cream. So I'm going to do a demo on this and let you kind of watch and see what happens. Normally, your technician will wear gloves, but since I am treating my hands myself, I won't be wearing any gloves so that I can do treatment quickly and efficiently. We do use a gliding agent just to help it travel back and forth on the skin. Perfect. So pretty much we're just going to run the unit. I've already done my hands, so I'm smiling and not grimacing. Run the unit back and forth a couple of passes. Depending upon the depth and the issue that we're treating, sometimes this procedure can draw blood. You may get a little bit of light bruising or just a little blood dots on the skin surface. That's entirely normal and desirable. As you can probably see, the surface of my hand is starting to get a little pink, so we're getting the blood flow stimulated. There we go, and I'm going to start here and go the opposite direction. You can do any area of the body. Normally, people always treat their face. I'm treating my hands because I'm getting to be a little old lady and I don't want my hands to look old. We can treat your arms, your face, your neck, your knees, anywhere where your texture is not desirable. But again, 3 treatments minimum, spaced every 4 to 5 weeks apart, and we can help you look younger, brighter, and happier. How easy is
Graper
that?
Harper Cosmetic Surgery.
See
And I'm here to tell you about.
You guys are.
Well, hello, ladies and gentlemen, if you're watching. Angie.
Cheers. Welcome to Cocktails and Conversations.
Alrighty, as you just saw, that was the video of the skin pen microneedling. That one actually helps with pores and texture in the skin. It's a very easy procedure to do. First time skin patients can do that. Not a lot of downtime. Again, it refreshes the skin, kind of gets things cranking, gets that collagen stimulated to a small degree. But my friend here, Angie, is getting ready to tell you about the RF microneedling. And I think that is going to be the next video up, the RF microneedling, Morpheus.
Any questions about regular microneedling?
I'm going to put this.
Okay, so to answer the gliding agent question, so that's kind of skin dependent. That's really kind of up to the esthetician. We use HA, we use peptides, so there's different gliding agents that we use to accomplish what we're trying to accomplish. Really, it's really skin dependent.
Exactly.
But most always it's sold in a series of 3. Sometimes 6, depending on if you're treating the face or if you're treating the body.
Oh, and there's a recovery time bruising. Now with regular microneedling, there is a very minimal bit of bruising around the eyes and maybe around the nose. If you're doing the Morpheus, there's a little more, okay? But you can wear makeup after 24 hours with the regular skin pen microneedling. With the Morpheus, just a couple of days, but you're back into your life pretty quickly with both procedures.
Yeah, the biggest thing I would say, wouldn't you say, Melissa, is sweating, for the first 48 hours. Really, after doing microneedling, We have so many tennis players and active patients. We just ask that you not perspire for 48 to 72 hours.
Take a little bit of a break per your esthetician.
And you can because you look amazing. You look amazing.
Yeah. Now, someone asked about the PRP with microneedling. Yes, you can do PRP with regular skin pin microneedling and with the Morpheus RF microneedling. So
Yep.
the PRP can be piggybacked and added onto multiple procedures.
It does work on top of the hands. Yep. Can be used on any body part. Again, you know, depending on your age and the severity of your wrinkling, I would say that's kind of up to your esthetician, how many you would need for your hands. But yes, it works very well. Remember that microneedling is designed to stimulate collagen. So yes, can definitely work on the hands.
Any area of the body pretty much can be microneedled.
We don't like to say if you're dealing with pigment on the top of your hands, we would rather, you know, BBL, you know, that's a different procedure.
Yeah, that is huge. If you've got the brown blotches you're trying to cover up and the little roadmap of the vessels on your face, yeah, BBL is good for that.
Yeah, that's totally different. That's a different category.
Okay. Yeah. Do we want to see the Morpheus now?
Okay.
What is the recovery time?
Recovery time.
Oh, yeah.
Skin pin.
24 hours. In 24 hours,
Yeah.
you're in makeup. Again, you may, like I said earlier, you may have a little bit of bruising around the eye, slight bit, maybe a little bit around the nose, but within 24 hours, you're back in makeup and back in your life. So you can cover up any little indiscretions that result from the procedure.
So just to recap, I mean, you have the microneedling, you leave the office, you're pretty pink, you have a call, you come back in 4 weeks, you have another one, you have a protocol. So again, sold in a series of 3, but really very easy, very easy. Okay, so let's get the next video. That is the radio frequency microneedling with the Morpheus 8. Hi everyone, we're going to talk about radio frequency microneedling, the Morpheus 8. We use this device for skin tightening, collagen remodeling, starting from the dermis all the way up. So here we go. We're going to start where women complain about their turkey neck, right in this area on the platysma band. We have numbed our patient, so she's ready to go. Very comfortable working this submental area here. This is an area that is always a concern for women and men. Talk about the difference. So you just saw the radio frequency microneedling. Melissa talked about regular microneedling. Sometimes patients will hear us say or call radio frequency microneedling in our room microneedling on steroids.
It is.
And so definitely there's a little more downtime, but clearly there's a lot more taking place in the skin. So the needles are heated. They're delivering energy into the skin at different millimeters of depth. And so it causes a lot of contraction in the skin. And so what we see is sometimes patients come in for a consult with the doctors. Maybe they're just not ready, whatever that is, commitment, or just simply not ready. And they refer them to our department, and the radio frequency microneedling is a great choice for just this sagging in this jowl area. We hear so much about that in our room, right here in this platysma band. So we can do it all the way from the forehead down to the clavicle, but most always from the eye area down to the clavicle. But Morpheus, the radio frequency microneedling, can be used everywhere. We've seen some great results on knees. I've had a series on the arms that was fantastic, the tummy. So a lot of times we will go in with Dr. Harper, Dr. Graper after a liposuction or whatever the case might be, and just tighten that area right around the belly button. So the radio frequency can be used pretty much anywhere and everywhere. Downtime. Well, let's talk about prep first. So you do have a numbing cream, and so you numb for about 30 to 45 minutes. You marinate in that. We do have Pronox available, so you can laughing gas. Yep,
sip a little bit of that.
Make you laugh and make you feel happy. And we have Valium, other things that are available to make you comfortable during the procedure. We want you to be comfortable. We don't want you to be in pain. And then, you know, three sold in a series of three, usually 4 to 6 weeks apart. And we do have a protocol afterwards that we use, and that can be PRP. It can be skin nectar from elastin. We have a whole different, you know, a variety of things that we can choose for you. Again, dependent
upon the patient, the skin type.
Yeah, but we have seen, we've had it for a little over a year. And it's been amazing. It's been one of the things that's been a game changer for our department.
Which is great. Sometimes what we do can bridge the difference between surgery and just your basic products that you're slapping onto your skin. You may not quite be ready for surgery to the extent that the doctors think you need it, but you're just not quite happy with what you're looking in the mirror and seeing. So that's where some of our procedures that are non-surgical can bridge that gap.
And I would say we've seen such an increase in non-surgical procedures in the last 5 years. I mean, Melissa and I have been estheticians for, you know, over 30 years. And in the last 5 years, non-surgical devices have just blown up. And even though, I mean, even when we do the Morpheus, you know, fast forward, you've had a series of 3 and you finish that series. And then sometimes you might need a little microtox on your neck, you know, still doing chemical peels on your neck, making sure that you're doing Nectifirm, things that people tend to think that just because I had a procedure, I never need to do anything else.
It's rarely, especially when you hit 40 and above, there is never a one and done procedure unless it's surgery. And even then, sometimes you need a little tweak with things to kind of fluff up the sheets a little bit. So yeah, we have lots of magic wands that we can pull out, but there's no one big magic wand to make everything disappear.
That's what I've always heard Dr. Graper say, is the clock keeps ticking.
True.
So, yeah. So we want to call up the video of Diamond Glow. Oh, wait, I'm sorry. Let's answer some questions.
So it's a non-invasive skin resurfacing treatment that is great for all skin types. It helps with fine lines, wrinkles, brightens the skin, helps clear out any congestion. We have the newest and greatest serums available, which is the Tns Advanced Serum and the HA5 Serum. This treatment can be done year-round with little to no downtime. Allie here has beautiful skin, but the Diamond Glow can help enhance it by clearing out any congestion that she has going on here in the forehead. She already has a nice glow going on, but we can just improve on that by making it a little bit brighter. And it will also help with any of the unevenness that she has going on in her skin.
Okay, everyone. That was a great demonstration from Angie Adamson with the Diamond Glow. Diamond Glow has so many opportunities. It's a manual means of exfoliation as opposed to a chemical means of exfoliation. It's one of our specials tonight.
Oh, yes. We'll tell you about that a little bit later.
Yep. But Diamond Glow it's fantastic. Again, you know, it's not a one and done, but we have the new TNS Advanced Serum that we can attach to the Diamond Glow.
We love that. So you get your exfoliation, you get a little lymphatic drainage with the treatment, and you're also getting an infusing of serums. So we can choose from a multitude of different things, but we have 2 new ones we're really, really excited about. Really excited about.
So we have the TNS Advanced Serum, which a lot of our patients absolutely love TNS. It is an advanced serum. It is an aging product. We can infuse that into the skin, and then you can take that product home with you as well. We also have the HA5, which is a hyaluronic acid, which has been huge in our industry for the last probably 5 to 8 years, really. So again, it's a manual means of exfoliation as opposed to a chemical means of exfoliation. Let's see what questions we have here. Do you have before and after?
36. Yeah, 36. Oh,
Yeah.
any age can do Diamond Glow. And quite a few of the procedures that we have, Diamond Glow specifically is one. People think that during the summertime, you can just go on vacation with your skincare. Please don't do that. You are going to age during the summer. So Diamond Glow is perfect for summer treatment. If you're worried about getting a peel and being in the sun, it is absolutely fantastic. So you can continue to do your skincare during the summertime, but still, you know, be a little bit easier. Diamond Glow is wonderful.
I think so too, Melissa. I do, because I feel like sometimes if patients are beaching it, you know, or in the sun or tennis or whatever that looks like, chemicals can sometimes be a little too harsh. So Diamond Glow is again a manual means of exfoliation, a great alternative for summer. So,
and you can do more than the face. You can do the neck, the chest, the hands.
Yep, you can anywhere.
You have skin everywhere.
So I see. We're so glad we're addressing the neck. You know, I feel like that's been part of our problem. Like everybody treats their face, but nobody treats their neck, their chest. So definitely, we are in the business of treating the full body. Face, neck, chest is a must. Is Diamond Glow good for any age? Absolutely. Diamond Glow can be used on any age. We've actually used it on a lot of our teenagers because we have pore clarifying serum.
The acne patients, wonderful for that.
Yeah.
All righty. Now, we have some lovely little specials to tell you guys about. Here we go. So you guys can call the office tomorrow and give them this code. So you'll get privy specials, definitely. Of course, we just talked about the Diamond Glow. You can get the Diamond Glow, a package of 3. It is regularly $450. We've got it on sale for $399, and that's a very good deal. The HA5 infusing serum, if you get that with your Diamond Glow, you'll get 20% off of an HA5 take-home product, and I think a free travel product to go with that, if I'm not mistaken. Also to the TNS, which everybody loves, the peptide yummy stuff, and the growth factor. If you get that infusement in with your treatment, you also get a free take-home product and a free eye mask with that. We've got some ZO specials. ZO is one of our favorite lines. I'm just going to tell you a little bit. You can get 20% off of ZO in general, but if you purchase $200 worth of ZO, you'll get the Getting Skin Ready product, the little gift bag thing.
And what's in that?
That is the Gentle Cleanser. That is the complexion renewal pads. Let me tell you about those, and the oil control pads, bomb diggity. Okay. And we've got the exfoliating polish in there. I like to put that on my lips to get those dry little flakies off the lips.
So good in the summer. Yeah.
Take this one.
Okay. Fight you for it.
Okay. Also too, we've got a giveaway. The ZO Beauty Box. So one lucky winner that is attending our Facebook Live seminar is going to win these goodies. I won't tell you.
I didn't know it was fantastic.
Yeah, so we've got the cleanser, the
You
toner,
can't see it
all
yet.
kinds of good yummies, full size products, okay? So I think we've kind of covered. If anybody doesn't have any more questions? Any questions? Ever since COVID, when we started wearing masks, my neck has broken out. Girlfriend, maskne has been horrible, but we can help you with that.
Yeah,
we can definitely
it's
help
definitely
you
been an issue that all the estheticians have dealt with. I do want to mention the other 2 estheticians. We have Angie Adamson and Candace Workman that's not with us tonight. It's just me and Melissa, but there are 4 of us that are here for you. So we look forward to hearing from you. We hope to see you in for a consult and for treatment. And we're going to introduce our nurse injectors. We have Kristen Hall and Linda Owens.
Awesome.
All right. Thank you so much for joining us.
For cocktails and conversations. Hope you've got your beverage of choice, and we are going to talk to you all about what we love. We are your 3 nurse injectors here at Graper Harper Cosmetic Surgery. I'm Linda Owens.
Kristen Hall.
Terry Trudnak.
And we're going to talk to you about injectables, Botox and fillers. And y'all, this is what we love. This is our passion. This is what we do every day, all day. And we just want to share that with y'all. Botox is a neuromodulator. There are several on the market. Botox is the gold standard. And Botox weakens muscles and it helps to soften fine lines.
Smooths that skin out. It's beautiful.
It doesn't, you know, some people say, I don't want to look different.
Yeah.
Botox looks like you with fewer lines.
Softer.
And we're going to go over on-label and off-label uses. Botox is good for the frown line. It weakens these muscles. You're still expressive, but you're not going to scrunch and look angry or upset. It also is good for the frontalis, the forehead muscle. Now, Terry's got smooth skin. We try to keep each other toxed up pretty good. And then it's also FDA approved for the crow's feet. Takes a few days to kick in, and you will enjoy the effects for about 3 to 4 months. Most people come in about 3 times a year. And then we're also going to tell you about some off-label areas that we love treating with Botox.
Yeah, so this is one right here, the masseter. So this is your muscle that you chew all the time. So this is one where if you have TMJ, grind your teeth, this will relax that muscle and relieve some of that, pain for you there. It can also slim that face for you a little bit. The lip flip, that's another one that's really popular. You do a couple of units and it flips that lip a little bit. It's almost like a little bee stem look. You know what you say?
It's beautiful. It just prevents that upper lip from turning in. It's beautiful.
Then we have one that's gaining a lot of popularity, the chinulite. So that's when the chin puckers in and gets that little pebbly look.
Orange peel texture. Where we hold our chin tight and we just weaken that mentalis and it smooths the chin. Another area, and Kristen's actually going to demonstrate this for you all tonight, is micro Botox in the neck. It's for the tech neck where we find ourselves looking down so often on our cellular devices. This is going to soften these little fine lines, and so Kristen's going to demonstrate that.
Yeah, it also will give it like a shrink wrap kind of appearance. So it's an easy treatment. It's superficial under the skin. It's kind of cool to watch. You can also do filler in the neck too in combination with it to help with the tech neck and those lines.
Juvederm is designed to replace shadows for light. We just want to plump up those shadows. We can do a liquid facelift by Voluma Here to Lift, Velour, Volbella, Ultra Plus to turn the corners up, maybe even treat those folds, maybe even camouflage the jowls where there's a little deflation, right in here. We just add a little filler. Again, we're replacing shadows. We're trading shadows for light. And it's beautiful. And you walk out of here in less than an hour looking fresh and lifted. There's so many to choose from. Don't let it overwhelm you.
That's our job.
That's what we're here for. And we'd love to meet you. Tonight, this is your chance. Hit us up. Ask us any questions, any burning questions that you've got for us. We have got years and years of experience, and we'd love to meet you. We'd love to treat you, and thank you for joining us. Cheers.
Cheers. Hey everyone.
Thank you for joining us. We hope you enjoyed the video. I'm Linda Owens.
Kristen Hall.
And then Terry Trudnak was our model and our other injector. And we just want to share with you all what we do all day, every day, injectables. So injectables are
Botox, fillers,
all of that yummy stuff. And y'all make sure you stay tuned until the very end because we have a special code, and you can call our office tomorrow with that code since you joined us or since you're joining us tonight. And with that code, we have some wonderful specials.
Yes, we get our Botox. You buy 2 areas, you get 1 free. That's pretty cool.
Oh man.
Yep, that's good.
Okay, that's great. So buy 2 areas, get 1 free. This is an amazing opportunity. If you, for instance, are typically getting Botox just for the frown line, maybe the forehead.
Try your crow's feet.
Try your crow's feet. Right now it's summertime.
Yes, we're squinting.
Days are longer. We're out with the kids in the sunshine, and we don't want these to become permanent or deep creases. So try the crow's feet.
Or if you're getting already, you between your brows, forehead, and crow's feet, there's some off-label uses that we do. We do the lip flip, we do the chin, masseters.
Yep.
That chewing. So if you have TMJ. It helps soften those muscles, slim down the face. So there's so many uses for it.
Well, and in our video, the micro Botox of the neck.
Yes.
So again, Botox on label areas are the frown, the forehead, and the crow's feet. But there's so many off label areas that we are well versed in.
Mm-hmm.
And the micro Botox of the neck actually just tightens up that neck a little bit. And it's not a neck lift. It's not a facelift. No. That's Dr. Craper and Dr. Harper's forte.
But it looks good. It changes the texture, and you can also do it under the eyes. Not everybody's a candidate for it, but we can help guide you with that. And that's another great one.
That's a great area. If y'all have any questions, just shoot them to us and we will answer them for you. Mm-hmm. But there was another special we didn't talk about.
Yes, filler. You get to save $100 off 2 syringes, and everybody needs to.
Well, let's talk about that because we both have patients who will come in and say, are you sure 2 syringes? That seems like a lot. Seems like a lot. There is a 1/5 of a teaspoon in each syringe, and so it literally would take 5 syringes to even have a teaspoon of product in your face. And also those of you who already know us, thank you for allowing us to treat you. And that our goal is beauty, natural and conservative. So absolutely. It's going to be really pretty. Let's see. Would love to try the lip flip with my 11s. So the 11s are those the angry area, the mean mommy look. Botox is not a filler. If you have already got deep creases in the glabella or in the forehead, in the crow's feet, it's not too late to start your Botox. Your Botox is not going to fill up those creases, but it's going to soften significantly.
Yeah, if you keep up with it for the next 2 years, it's great to have patients come back and you can see your before and afters before you started treatment, and then 2 years later, before, when you come back to do your treatment, you'll be able to see the difference in your skin.
It's amazing. Yeah. We love to take your before pictures, and it is fun 2 to 3 years later going back just for kicks and giggles and to look at those pictures, and you'll be amazed at how you'll look more youthful 2 or 3 years later. Because again, that Botox, because it weakens the muscles that it's injected into, it will prevent those creases from getting any deeper. Yeah. We're very animated people and we use those muscles. So, and Botox, a lot of people who maybe have not tried Botox are a little fearful. Do you hear that?
A lot of people say they don't want to look frozen, and it's dose dependent on everybody, right. And we know how much to put in you. We know what how your muscle moves. We're looking at you. So we're not going to overdo it. And you're going to come back for your 2-week follow-up, and we're going to check you. And if we need to do some tweaking, that's when we'll do it.
We will. And somebody's asking about the lip plumpers and the lip flip. So lip flip, that's just a fun little, it's a slogan now, but we do love a lip flip. Again, if Botox weakens the muscles, when Botox goes into the orbicularis muscle that puckers your lip, it will weaken that muscle and it gently everts it to give you more showy lip.
Like a bee stung look.
A little bit like that.
Right.
A true lip flip, however, is not just the Botox, but also some filler.
Yeah.
Our fillers are hyaluronic acid in a gel form. Hyaluronic acid is what your skin's made up of. So it's soft, it's smooth, it's pretty, it's not lumpy, it's not bumpy, it doesn't look funny, weird, or done. Yes, you might be a little swollen when you leave out of here.
Yeah.
Most people scoot on out of here and go on about their business, and you'll love it. You'll be really happy. Our lips, don't be afraid of getting your lips done and cheeks done. We hear that too.
You hear that all the time.
Oh
yeah.
my gosh, I don't want to look like.
I don't want to look crazy coming out of here. And that's not our goal. We've been doing this for a really long time, and we take pride in what we do, and we want you to feel refreshed. And we don't want anyone to say, where'd you get your filler done? We want people will say to you, oh my gosh, did you get a good rest last night? Did you change your hair? No one's going to, that's not our goal for them to be like, where'd you get your filler?
It just looks fresh.
It looks fresh.
Lifted. Good question here. How long do most of the fillers last? They are FDA approved to last 12 months to 24 months. Yep. That does not mean that at 12 months or 24 months, your filler poof goes away. It's like your Botox, it gradually goes away. I mean, let's face it, we don't want our filler to go back to ground zero. We want to keep it fresh. Yeah. But most fillers, the ones that we use, are FDA approved for 12 months, 18 months, or 24 months, depending on the areas. And each specific filler has a specific place. And, that's what we're here for. This is what we're passionate for. Yep. This is what we do. We love it. We will do a full face assessment. Yes, we're going to listen to what you're interested in doing, but you might come in and say, I just hate these folds. Right. And you've got a little bit of fold there, but what's the best treatment for a fold?
Yeah. You need to do your cheeks. You need to lift that. The fat, as we age, everything kind of comes down.
Everything falls.
The folds are a symptom of the fat pad that used to be here, just starting to come down a little bit. So we can do the folds. It's kind of just putting a Band-Aid on it. Yeah. We want to do the correct treatment for you. And ultimately, you're going to look the best when we do it.
Well, because the Juvenile Voluma is the best product for that. Yeah. Not only does it fill where the fat pad fell, but it also gives you a lift. And it supports that lid cheek junction. And so it makes the lower lid even look better.
Oh, yeah.
But now Volbella is FDA approved for the infraorbital hollows, the lower lids. We've been doing it for years, but now there's a product specifically that's FDA approved.
How many units per area?
So good question. How many units per area? And I didn't see that. I'm sorry that I saw that. I saw that my nephews are watching. Auntie Linda will hook y'all up with Botox too. Just stay tuned for the code so that you can get the special. Depending on which areas, what's typical, the typical amount for the glabella is 20 units. Yep. For the forehead is 20 units. For the crow's feet, 24. That's just an average. So for a full upper face on label is 64 units. That is, I'm a national trainer for allergy. And when I train other offices, I have to teach them that 64 units. But then I follow it up and say what we know. It's not cookie cutter. Every individual is going to have a different treatment. 64 is not enough for me. I mean, I think you socked me with probably 85 or so.
Easy.
Easy. Takes a village.
I am 75. Can Botox help my deep creases?
Yeah, so 75-year-old, will Botox help my deep creases? I just had a patient last week who has never had Botox, and I think she was early 70s. So she's got the deep etched grooves. Botox will not fill those grooves, but when we, I'm going to borrow this, when we express, we frown, we scrunch, we raise, and after 20, 30, 75 years, we have permanent creases, static lines. Yep. Botox will not fill those up, but it's going to significantly soften those lines. Yeah. More importantly, for our 75-year-olds and our 55-year-olds and our 25-year-olds, it's going to prevent those from getting deeper. Because we are very animated. And matter of fact, speaking of the 25-year-olds, we do have a lot of younger folks coming in, and they're just, I'm amazed at it. And
they want to be preventative. They know more.
Prophylactic treatment. Mm-hmm. Yeah. They do know more. They're taking care of their bodies and working out, eating well, and they're preventing those permanent creases. So kudos to them, young folks. I'm bummed. I was stuck at work. Finally able to log on. Hey, you're not too late. We have a code. We have a code. You're not too late. We're going to turn it over in just a minute.
Yes.
Any other questions? Anything that? Dysport,
yeah.
yes. So Botox, Dysport, they're both neurotoxins and they're beautiful products.
Yeah.
Different companies. One's Pepsi, one's Coke.
Yep.
When Dysport first came out, and we'd been using Botox for years, you know me, I'm a side-by-side study gal. So everyone here in the office, we did, half face, half Dysport, half Botox. And they're both great products. They're both neurotoxins. They
Weaken the muscle.
They kick in a few days, and average it lasts for about 3 to 4 months. Again, it gradually wears off. We've got some patients who stretch it out and they come every 5 or 6 months.
Yeah.
And then got patients who are on the doorstep
2 months.
2 to 3 months, and they're like, I see some movement. I
Yeah.
don't like that.
So it's really dependent on the individual.
personal preference.
Yeah, really.
Yep. Wondering if you offer Sculptra. Currently, we do not offer Sculptra. We have used Sculptra in the past.
Yep.
We may revisit that. Sculptra polymactic acid, it is going to require 3 treatments. 1 treatment, then a month later, another treatment, and then a month later, another treatment. And
takes a while to get to see results.
It's a pretty treatment. It's nice, but it does take a while. And what we have found is that most patients are wanting more
immediate results.
And so typically we're using the hyaluronic acids, the Juvederm, that's FDA approved up to 2 years, depending on the products. Our little toolbox is full of products. We've got 5 in the Juvederm family, and
They
actually
do amazing stuff.
Yeah, they do great. We've got 2 new ones
coming out.
Yep.
So we can't wait to talk to you about that. That's coming out in the summer. 2 new products from Allergan.
Yep.
Juvederm.
All right.
Okay.
So,
again, let's recap the specials because these are really great.
All right, y'all.
Let's show the codes.
Ready?
Dun, dun, dun. All right, so call tomorrow with your code.
Here's your code.
You get, for Botox, you buy 2 areas.
Beauty 22.
You get 1 area for free.
Yeah.
Filler, you buy, it's $100 savings off of 2 syringes. And also cool sculpting. I'm your cool sculpting master.
Yeah.
If you want to do cool sculpting, we do complimentary consultations.
Cool.
It's so cool. And I'm cool.
You're cool.
You can buy 1 area or buy 1 treatment, get another treatment for free. It's part of a package that we're doing. And when you come in for your consult, I'll go over all that with you. But it's a really great savings if that's something that you guys are interested in.
Oh, I'll see you Wednesday night. So make sure you call with the code. We appreciate y'all joining us. Make sure you call our office and take advantage of this special. From the doctors, Dr. Graper and Dr. Harper, who do such amazing surgery in our accredited facility here with, all type of body procedures and facelifts. Just they're amazing. And then our
estheticians,
4 estheticians, they just
hands down amazing,
the best. And then we're all right.
Yeah.
Your 3 nurse injectors. So we would love to see you. This is our passion. This is what we love.
Yep.
And we would love treating you. We appreciate you joining us. And so, all right, here's your code.
Here's your code. Take advantage. We look forward to seeing everybody. Bye.
Cheers.
Cheers.